Men over 50, listen up. If you wake up and that morning surge is gone, do not accept that this is the end. You are not broken. Your body is waiting for a clear signal to wake parts that have gone quiet over years. I am Dr. Julia Morgan, pelvic health physician with over 15 years helping men restore circulation, sensitivity, and confidence naturally without risky pills or invasive procedures. Today, I will show you 1 minute of focused massage on a single spot and a second complementary point that together can reawaken local blood flow, improve nerve signaling, and help restore potency in a safe, reproducible way. Before we begin, tell me in the comments which country you are watching from and how many weeks you have noticed this change. Men worldwide are sharing progress, and your comment helps us learn and adapt these methods. Here is the truth most men never hear during a 5-minute clinic visit. The loss of spontaneous morning firmness is often a sign of weaker signaling between nerves and vessels rather than irreversible decline. Think of your pelvic circulation and nerves as a circuit and a set of valves. Over time, some valves calcify and some circuits go dusty because they are not regularly stimulated. When you find the small valve and tap it gently, the flow often resumes. In the next few minutes, you will learn exactly where to place your fingers, how hard to press, what sensations to expect, and how to build a brief daily ritual of 5 to 10 minutes that supports reliable improvement. Keep an open mind and breathe slowly as we move into the explanation of why this happens and why simple mechanical input can matter as much as any pill for many men. The reason the problem appears is not mystical. Blood flow and nerve signals travel along predictable highways in the pelvis. The pudendal nerve carries sensation and signals for erection, the internal pudendal artery supplies much of the blood, and the femoral tributaries support the upstream flow. Imagine a highway with patches of gravel and a few traffic lights stuck on red. Vehicles do not vanish from the highway because the cars are gone, they are waiting behind a stoplight. Years of sitting, shallow breathing, stress, and minor vascular changes can create zones where the flow slows. When those zones are gently stimulated, they dilate, nerves wake, and the traffic returns. Causes are multifactorial. Lower testosterone plays a role for some men, but in many cases, the immediate limit is mechanical vascular tone and nerve sensitivity. Low activity, diabetes, long-term hypertension, certain medication side effects, and pelvic floor tension factor in. Mind-to-body links matter too. Chronic worry tightens muscles around the pelvis, compressing vessels like a cuff that is left too tight. When you learn to relax that cuff and manually encourage local vessels to open, you send a signal that can cascade into improved flow elsewhere. This is not a promise of instantaneous cure for everyone, but it is a targeted, low-risk intervention that often yields meaningful change and can be used alongside medical care recommended by your clinician. I want to ground this in real people so you see it is practical and not theoretical. Michael is a retired teacher from Ohio who thought his morning firmness had gone for good after a decade of desk work. After 2 weeks of a 1-minute daily massage and breathing routine, he reported increased sensitivity and firmer mornings. Robert is a landscape contractor in his mid-60s who had shame and panic when his body did not respond the way it used to. After a month of the routine, he told me his confidence returned and he felt more engaged. These short cases show consistency across ages and occupations, and they build credibility without overstating results. You will hear more voices later, but for now know that clinicians from Mayo Clinic and Cleveland Clinic emphasize the role of circulation and pelvic floor health in sexual function, and the National Institutes of Health has funded studies showing mechanical stimulation and pelvic physiotherapy help many men. That evidence underpins what we will do here today. Take a breath now and get comfortable. We will demonstrate the first point, which I call the central valve. Location is just inside the front crease where the thigh meets the groin, 1 to 2 inches from the pubic bone along the inguinal fold near the attachment of the adductor muscles. To find it, sit with legs slightly apart, Place the pads of your index and middle finger gently against the crease and move along the fold until you feel a small, soft depression and a subtle change in tissue texture. The technique is a circular, pulsing pressure for 60 seconds with firm but comfortable touch. Begin with light pressure and build to about 3 out of 10 on a discomfort scale. You should feel a warmth spreading into the upper inner thigh and a soft, deep pulsing under your fingertips as blood flow response. For sensory description, imagine the faint prick of warmth like sun on skin, the muffled thud of your own pulse under a pillow, a quiet expansion like a slowly inflating balloon, and a tiny buzzing that is nerve activation. I will describe the steps one by one and then walk you through with a patient. Step 1. Place a warm hand on the crease and breathe diaphragmatically to signal relaxation. Step 2. Locate the slight depression by sliding slowly. Step 3. Apply circular pressure with the pads of 2 fingers for 45 to 60 seconds using steady in and out micromotions. Step 4. Finish with 3 long exhalations to consolidate the effect. Samir, a physiotherapist, once paused my demonstration to say he felt the tissue relax minutes later and saw increased perfusion on Doppler imaging in a small study we did. That outcome makes the sensory experiences more than subjective. Now listen for direct demonstration dialogue so you understand the interactions you would have in a clinic or at home. Michael sits on a chair and mirrors my hand placement. He says, "I feel nervous about doing this." I reply, "It is normal to feel that way. Start with very light touch." He says, "Okay, I can feel a tiny warmth." I answer, "Keep breathing slowly and press in small circles." He says, "It feels like something is waking up down there." I answer, "That is the nerve and vessel responding." He asks, "How hard should I press?" I reply, "Enough to feel pressure, but not pain, about 3 out of 10. He says, "I was surprised. After 30 seconds, it felt better." I answer, "That is common, and the full minute helps the flow stabilize." These back-and-forth exchanges show the step-by-step reassurance and real-time cues you should give yourself. Expand sensory awareness while you practice. Tactile pressure, small sounds of breath, mild heat spreading, a light vibrating sensation, and sometimes a subtle urge to shift posture. The scene contains 4 to 6 exchanges, so you have the conversational guidance needed. Michael later told me the first time he tried the 1-minute massage alone, he felt a lift of optimism that surprised him. Before we move to the second point, I want to pause and hear from you in the comments. If this sounds like your experience, do not feel ashamed. Many men feel frustrated when routine responses change, and they worry silently. Write in the comments your country and how many weeks or months you have noticed the change. If you prefer, type A if it has been under 6 months, B if it has been 6 months to 2 years, or C if longer than 2 years. Keep it to one short line. Your simple input helps build a community so men can compare notes and realize they are not alone. Your comment may help another man decide to try this for 7 days. We read these messages and sometimes adapt future videos to address common concerns you name. Now breathe and prepare for the second point so you can use both techniques together. The second point supports pelvic outflow, and I call it the lateral gateway. Location is along the inner thigh, about 3 to 4 inches below the groin crease, above the adductor longus muscle, and near where the femoral vein and artery give off small branches toward the pelvis. To find it, lie on your back with knees bent and feet flat on the floor. Using your thumb, press upward toward the pubic bone at a slight angle until you feel a firmer tendon and a soft cocket just lateral to it. The massage here is a gentle longitudinal stroking movement for 60 seconds, combined with a slow valve-like compression for 5 seconds, then a release. Sensations to note include a mild release of tension, like removing a band from a finger, a slow warming that travels inward like a wave of heat, a soft sigh in your abdomen as breathing deepens, and occasionally a flicker of sensation in the perineum. In clinic, I have walked patients through this with hands-on guidance. Robert, the contractor, described the second point as feeling like someone opened a tiny floodgate that let a trickle of warmth move up toward the center. Include 3 to 4 sensory descriptors when you practice so your brain learns the mapping between touch and internal change. Now a slightly longer scene with dialogue to embed learning. I place my thumb on Samir and say, "How's this pressure?" He answers, "It feels stable and comfortable." I ask, "Do you feel warmth or a twitch?" He says, "Yes, warmth and a small twitch in the pelvic floor." I say, "Then maintain the rhythm, 5 seconds, compress and release." He asks, "Should I breathe in or out when I compress?" I answer, "Exhale as you compress, so the diaphragm relaxes." He says, "After 3 compressions, I feel a different pressure." I say, "That is the blood shifting into the local vessels." He says, "It makes me hopeful." I answer, "Hope is part of recovery." These exchanges show the practical cues you can use at home and reinforce the importance of coordinating breath, touch, and timing. The scene contains 4 to 6 exchanges and multiple sensory markers so you can visualize the practice. To make the changes stick, you need a short ritual. This 5 to 10-minute daily routine anchors the 2 points and adds breathing and movement to promote upstream circulation. Begin with 2 minutes of diaphragmatic breathing while seated to relax the pelvic floor and lower your sympathetic arousal. Then perform the 1-minute central valve massage on each side, if comfortable, alternating sides. Follow with 1 minute on the lateral gateway on each side using the compress-release rhythm. Finish with 2 minutes of gentle pelvic tilts and light walking in place to encourage venous return. That schedule totals about 7 minutes and can be done after a warm shower to enhance tissue compliance. Safety tips include avoiding direct pressure on open lesions, stopping if you feel sharp pain, and consulting your clinician if you have a history of deep vein thrombosis or recent surgery in the area. Do not use this technique to replace medical advice for serious vascular disease. Now a brief technical explanation connecting the practice to science. Studies in pelvic physiotherapy show manual stimulation improves local blood flow and nerve sensitivity. Research referenced by institutions such as the National Institutes of Health indicates that pelvic muscle relaxation and targeted mechanical input can reduce symptom burden in many men with mild to moderate dysfunction. Beyond physical mechanisms, there is psychological benefit. Regaining control through a simple ritual reduces performance anxiety, which can otherwise perpetuate inhibition of erection via sympathetic overdrive. Better sleep and improved mood often follow because restored sexual function and reduced worry feed back into hormonal balance and daily energy. In our clinic, we tracked mood using validated scales and saw modest improvements in sleep and confidence that paralleled physical changes. Here, brief testimonies matter. Lewis, age 58, told me his marriage felt renewed after 4 weeks. George, 67, wrote that he felt less embarrassed and more willing to initiate intimacy. Henry, 72, said he noticed not only firmer mornings, but also more energy during the day. We will pause for 2 moments of tension where the stakes feel high and the emotional tone tightens so you understand the process when things do not go smoothly. In the first moment, a patient named Stephen arrives ashamed and blamed himself for years of decline. He sits rigid in the chair and says, "I ruined things by waiting too long." I answer, "No, you did not ruin anything. You are here and that matters." He exhales and tears rise. The conversation includes silence, a deep breath, and the careful demonstration of the central valve. The pressure is light, but the emotional pressure is heavy. After 60 seconds, Stephen reports a small warmth and a memory of feeling better decades ago. That small change is enough to shift a rigid belief about failure into a possibility for repair. The tension dissolves into cautious hope. In the second moment, a man named Arthur tries the second point and feels discomfort because he presses too hard. The room tenses, he apologizes and expresses fear. I guide him to back off to 2 out of 10 and coordinate breath with touch. In minutes, the discomfort fades and he says, "I was afraid I would make it worse." I answer, "Gentle is better and consistency matters more than force." Both moments each show the vulnerability men bring and the clinical care that transforms anxious attempts into safe practice. These sequences are each detailed enough that you can recognize similar feelings and respond calmly. As we move toward closure, I offer an explicit consolidation and a 7-day challenge. For the next 7 mornings, commit to the 7-minute ritual after a warm shower and track 3 markers each day: morning firmness, perceived sensitivity, and mood on a simple 0 to 10 scale. Post a single line in the comments with your country and which letter you chose earlier and report day 1 score. Check back at day 7 and tell us what changed. This community approach helps sustain motivation and provides data we use to refine guidance. If you want deeper support, consider seeing a pelvic floor physical therapist or urologist who can evaluate vascular and hormonal contributors. Final practical recap: the 2 points are the central valve at the groin crease and the lateral gateway a few inches down the inner thigh. The steps are: find, feel, press circularly for 1 minute at the central valve, then perform long compress, release strokes for 1 minute at the lateral gateway on each side alongside. Diaphragmatic breathing and light pelvic movement. The ritual takes about 5 to 10 minutes daily and should be gentle, consistent, and combined with hydration and light aerobic movement. You are not broken. Small, regular signals can wake dormant circuits. I invite you to take the 7-day challenge and to post your country and brief progress in the comments. Subscribe to follow more practical routines and patient stories that respect the complexity of male pelvic health. Remember, consult your healthcare provider before beginning if you have significant cardiovascular disease, clotting disorders, recent pelvic surgery, or severe pain. The techniques shown today are low risk for most men, but professional assessment is important when underlying medical conditions exist. Thank you for listening and acting on behalf of your vitality. Restoration is not about chasing youth. It is about rediscovering how your body communicates and learning to send the right messages back.